Sleep has been one of science's great mysteries, despite its ubiquitous existence across the animal kingdom. It is only in the last 30 years that we have seen considerable advances in the field of sleep science, which highlights the important influence of sleep on health and disease. Our 24-hour society promotes poor sleep behaviours, resulting in chronic sleep deprivation for many of us. Science is beginning to unravel the consequences of such behaviours on the brain, cardiovascular and metabolic systems. Sleep disorders such as obstructive sleep apnea, insomnia, restless leg syndrome and shift work disorder are highly prevalent diseases in our society. Not only do they overlap with other chronic diseases because of their high prevalence, they also influence the risk and course of these other diseases. Hence, to understand the traditional chronic diseases such as cardiovascular disease, diabetes and obesity, we need to consider the role of sleep disturbances. Obstructive sleep apnea, or OSA, is one of the most common and complex sleep disorders and is associated with impaired quality of life, a high risk of cardiovascular, metabolic and neurocognitive morbidity. The prevalence of OSA has increased dramatically over the last 2 decades in tandem with the obesity epidemic. Moderate OSA is evident in 17% of middle-aged men and about 9% of middle-aged women. Snoring, which is the precursor of OSA, occurs in some 50% of middle-aged men and half as many women. OSA is recognised as a significant public health burden and was estimated to cost the Australian healthcare system more than $21 billion in 2010. The mechanisms underpinning the link between OSA and cardiometabolic diseases stem from a number of characteristic perturbations that it induces during the sleeping state. These include upper airway narrowing or complete closure, intrathoracic pressure swings due to respiratory effort against the occluded airway. These pressures are transmitted to the heart and induce hemodynamic effects. Oxygen levels drop and they're followed by reoxygenation with each obstructive cycle, and this results in cyclical intermittent hypoxia or low oxygen levels. Termination of obstructed breathing through arousals activates the stress response or the sympathetic nervous system. These disturbances occur repeatedly across the sleep period, averaging over 30 episodes per hour in severe cases. This results in sleep fragmentation, hemodynamic changes and activation of inflammatory pathways and sympathetic nervous system pathways. Hence, it is not surprising that it produces symptoms such as sleeplessness, waking tired, daytime tiredness, impaired memory and concentration, all of which adversely impact one's quality of life. Equally importantly, the chronic effects of these nightly perturbations are now recognised to cause hypertension, as well as being associated with the risk of developing or worsening myocardial infarction, atrial fibrillation, stroke, diabetes and obesity. Observational studies have linked OSA to premature death, particularly from cardiovascular causes. Given the high prevalence of this chronic disease and its association with other chronic diseases, it is imperative that recognition and management strategies are developed in order to ease the burden associated with OSA. We have highly efficacious treatments for OSA, including continuous positive airway pressure, mandibular advancement devices, weight loss therapy, and surgical interventions. Recognition strategies for the primary care setting are still in the early stages of evolution. A focus on diagnosis via in-laboratory sleep studies has limited the number of individuals who end up on effective therapy. This problem is beginning to be addressed through the use of simplified home monitoring devices and other screening tools. There is a steady increase in the quantity and quality of research studies demonstrating the cardiometabolic benefits associated with effective obstructive sleep apnea therapy.